Good day, future doctors and medical technologies. Welcome back again to another episode of HIS Lecture with me, Sir Neil, and I'll be your professor for today. So today we are down to our last topic in our prelim coverage. Now we're going to talk about the health informatics. Okay, so I want everyone to listen because this will be a quite different take, quite different set of topic compare sa last lesson natin, because in our last lesson, di ba, we talk about the health system, most particularly in the healthcare aspect of the standing of the Philippines, no, against the best health system in the world. So here po, it is more on the IT side. Okay, so I want everyone to listen and try to understand it with me. Okay, so these are the learning outcomes that I want everyone to know at the end of this video lecture. You'll be able to define health information technology, discuss healthcare softwares, systems, and health information ecosystem, explain the advantages and disadvantages of health informatics in the cloud, describe the status of health informatics in the Philippines. So this is really going to talk about more on the IT side. Okay, so let's start. So, health information technology. So, remember that the dawn of information age has resulted into the generation of huge amount of routine data, particularly in healthcare, 'di ba? Kasi nga in the health system po, the more people ang nagpapa-check up, the more data yung mako-collect. Okay? So, with this, it will become perplexing to process and analyze. This is where health information technology comes in. So remember, this would be a big challenge for the health informatics, to make a sense of the large amounts of data while ensuring the processes are valid and secure. Okay, so the transition from a manual to a more advanced health information system is an overarching issue that sits between providers of healthcare, managers, policy makers, researchers, and patients alike. So obviously, in the dili na siya same sa una, guys, na manual pa imuhang sulat-sulat pa ang imuhang patients data. Ngayon, it's all saved in the cloud, and can be accessed anywhere. But still, gaya na sinabi ko sa inyo, that is visibly seen in the West. But here in the Philippines, dili pa kaayo. But still, syempre, since technology is advancing, what if someday, by the time you graduate, magiging okay na talaga ang ating health information system. Okay, so here we're going to discuss health information technology. Okay, so remember, guys, that one innovation that manages health information for better service delivery is health information technology. Okay, dito papasok yung health information technology. Siya yung mag-a-analyze ng mga data na nailagay natin. Okay, so isa-isahin natin siya. Okay, so according to Rus, in 2016, sabi niya, health information technology is the area of IT involving the design, development, creation, and use and maintenance of information systems for the healthcare industry. Remember po, we have plenty. We have lots and lots of industries, okay? And isa tayo, tayo as medtechs, we are involved in the healthcare industry. So all of the data that we garnered, okay, patients data na nakuha natin, results that we release, are being processed here in the health information system. Okay, and the technology behind is the health information technology. Okay, ano pang sinabi ni Rus regarding dito? Sabi niya, automated and interoperable healthcare information. When we say interoperable, guys, it refers to the able to exchange and make use of information. Siyempre, kung masyadong maraming information, you need to be able to interpret it. Yun po yung meaning ng interoperable. Healthcare information systems are expected to, okay, so ibig sabihin, kung yung mga patients data, patients result can be easily interpreted, it would benefit these 5 things, improve medical care, lower the cost, okay, increase efficiency, reduce error, and improve patient satisfaction. Okay, when you say efficiency, it refers to achieving maximum productivity with minimum wasted effort or expense. Okay, so yan po yung mabibigay ng health information technology if ma-adapt talaga siya dito sa Pilipinas. But actually sa West, they are really in the zone, nandun na sila eh, no? Ganahan ay na dyan nilang taman. Dito sa atin meron naman pero hindi pa ganun ka well established or standardized. Okay? So, meron tayong tawag yan, according naman kay, hindi ko ma-pronounce ang pangalan nila, bahala na kayo mag-pronounce, no? According sa kanila, health information technology provide innovation to healthcare delivery, obviously, no? If maganda yung pag-interpret ng data, pag-store ng data, it would really be good, it would really hasten the delivery of healthcare to people in need. Connection among users and stakeholders. So I already explained to you before what is stakeholders, ha? Okay, so we have different systems, no, such as electronic health records, decision support systems, and personal health records. These are promising and are becoming widely deployed worldwide. So remember po, kapag meron na tayong ma-develop na yung ating health information technology, no, a good health information system will be well established. So it means, no, kung maganda yung technology behind, all of the data gathered by the healthcare providers, no, from the patients will be easily interpreted, will be easily stored, and will easily be accessed by the doctors ng patient na yan. So kung mabilis yung mas madali yung pag-access nila ng data, no, ng mga patient na yan, so obviously, no, they can the healthcare delivery will be hastened, no? At the same time, it would be an ease access, no? Kanang madali na lang mag-share ng data between hospitals to hospital. So yung mga sinabi ko kanina, the electronic health records, these are records natin sa mga hospital na pinapasukan natin, no? Kung saan tayo nagpa-hospital mo, nang every time nag-a-ask jud sila na nano may record diri, pag magpa-hospital mo, no, nano may record diri, pag wala pa gawa tayo. Ganun siya. Pag meron ka ng old record daan, yun na yung i-access ni the information sa mga hospital. Okay? So, we have here health information technology and health information management. Okay? So, health information technology is information technology applied to health and healthcare. It supports health information management across computerized systems and secure exchange of health information between consumers, providers, payers, and quality monitors. While health information management, on the other hand, is information management applied to health and healthcare. It is the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient healthcare. So actually guys, no, they are kanang in terms of definition, no, they are most likely the same. Okay, when you talk about health, HIT na lang, no, HIT and HIM, you talk about the HIT po, information technology siya that is applied to health and healthcare. Same gap po na sila sa HIM. However, the difference between the two, no, kay ang HIT po is, is more on a computerized systems and secure exchange of health information. Siya yung nag-secure na yung data nito is successfully and securely, no, ma-transfer, ma-exchange yung information between the consumers, the providers, which is the healthcare providers, the hospital, no, the payers, and the quality monitors. Whereas, pag sinabi mo namang HIM naman, it is the practice po of acquiring, analyzing, and protecting digital data, no, protecting digital and traditional medical information vital for providing quality patient healthcare. Okay? So, traditionally using pen and paper, better management if supported by HIT. Okay? So, let's move on sa ano natin. So, with this two combined, no, you have the health information technology, then health information management. Technology is the technology behind, no, para makamanage ka ng health information well. Okay? So, magkaiba yan sila. And then, when you combine the two, you'll get, health informatics. So, when we talk about health informatics, it is the combination of two. So, it is the application of both the technology and the systems in healthcare setting. So, health informatics is a term describing the acquiring, storing, retrieving, and using of healthcare information to foster better collaboration among patients and various healthcare provider. Health informatics plays a critical role in the push forward healthcare reform. Utilizing both the HIT and HIM in order to increase productivity in the healthcare industry is needed. Okay? para ma-utilize well, no, para maging effective ang ating health informatics. Okay, so health informatics is the combination of the two, no? So you have yung ating health information technology and then the health information management. Most likely ka nang ang naga-secure po talaga ng information is the health information technology. While ang naga-analyze, nagakuha, no, naga-protect is yung ating health information management. So if you have the two, you have the health informatics. Okay? So since we have the brief idea of what health informatics is, let's talk about the different healthcare software systems. Okay? This one. Okay, so these are the healthcare software systems that are utilized, no, in our current era. Okay, so please be familiar with the different meaning ng ating mga abbreviation ng mga words. For example, we have the EHR, which refers to electronic health record. PHR, which is the personal health record. Dapat guys, memorize to ninyo, no, anong ginamin yan, no, HIE, yung PACS, yung VNA, because that will lalabas po yan sa ating like exam, and most likely naka abbreviate na lang po yan siya. Okay, so isa-isa natin sila, don't worry. Okay, so isa-isa natin sila. Let's start with the electronic health record, or also known as your electronic medical record. So this is the patient's official health record in digital form. Remember po, it is one of the fundamental components of your health IT infrastructure. Okay, so information is shared across multiple healthcare providers and agencies. So this is ito na yung sinasabi ko na data ninyo, no, electronic na health record ninyo, na instead of yung sa chart pa, no, naka-system na siya, no, naka-digital na siya. So kapag naka-digital, it would be easier for the doctors to gain access to this, the medtechs, no, gain access to this and upload your results, the nurses and other healthcare providers. However po, ito yung sinasabi natin that the though it is shared across multiple healthcare providers and agencies, here in the Philippines po, hindi pa ganun ka, well established ito siya. Kung sa ibang bansa, mabilis na lang kasi standardized na, dito sa atin is hindi pa po masyado. Okay, but remember, yan po yung ating electronic health record, no? This is the patient's official health record in digital format. Okay, so let's talk about the personal health record. This is a person's self-maintained and self-documented health record. Information typically includes your allergies, family history, medications taken, surgeries performed, hospitalization record. So this is an example po ng ating PHR, no, the personal health record. Okay, so dito siya guys, no, since this is self-documented, okay, self-maintained and self-documented health record, ito po yung tayo po, no, tao ang may nito ang naga-input dito, tayo po manually. Kung kanina sa ating electronic health record, no, pag magpunta ka ng hospital, lahat ng ginawa sa hospital, yung lahat ng mga laboratory mo, lahat ng mga ginawa mo sa hospital, sila ang mag-record doon. For this one, tayo po. For example, ako in my Samsung account, no, I have parang medical history, no, nandun lahat, nakalagay lahat, allergies na ako, family history na ako. So that is also an example of personal health record. Okay, so example of this is yung DOSIA, no, is a web-based DOSIA, DOSSIA, no, is a web-based framework. Pwede nyo i-search yun siya guys, no, web-based framework for storing and managing your personal health record. So para minsan kung merong mangyari sa'yo, na let's say for example, may nangyari sa'yo dyan, tapos wala ka, first time mo sa hospital na yun, you can share your personal health record. Though manually nila i-input kasi nga siya, but still at least kompleto na. Pero ito siya, sa personal health record, ikaw po manually ang mag-fill in po nito. Okay, I hope na gets niyo sa ating EHR, sa hospital to siya, no, sa kung saan ka na institution hospital. For the PHR po is pwede po siya ikaw, okay, manually. Okay, so we also have yung tinatawag natin na health information exchange, no. These are health data clearing house comprised of healthcare organization with interoperability pack to share data among health information technology system. So, ibig sabihin, now when you talk about clearinghouse po, these are the ones who collects and distribute information. Clearinghouse. Kanina, nabanggitan natin ang interoperability, no? Ulitin lang natin, it is the ability of a system or a product to work with other system or product without special efforts. Okay? Without special effort on the part of the customer. The use and implementation of the EHR systems have increased dramatically. Okay? Kasi nga, di ba, marami namang hospital ngayon. Hospitals and physicians using the government-certified EHR systems meet the meaningful use criteria and are qualified to receive incentives. So, since marami na tayong mga hospital po na gumagamit ng EHR, okay, para mas mabilis yung pag-share ng data across, okay, mabilis yung pag-share ng data across sa sa different hospital, different agencies. Dito na papasok si HIE, Health Information Exchange. So you have here a description, parang diagram, no? You have the patient here, no? Yung data niya can easily be sent to the laboratory, to the specialist, primary care, pharmacy, and the hospital. So si Health Information Exchange po yung nagpa-process po yan. Okay? So yung criteria po na binanggit ko dito kasi 'di ba lahat ng hospital, since they have their own EHR po, okay, so they need to meet a certain criteria para mag-benefit talaga yung patient. Okay, so the said criteria is regulated under the Office of the National Coordination or the ONC for Health IT, which certifies approved IT technology use under Federal Reimbursement Program and Centers for Medicare and Medicad services. However, meaningful use is exchanged due to the Medicare Access and Children's Health Insurance Plan Reauthorization Act, which is law on value-based reimbursement system passed by the US Congress in 2015. So, ito siya guys, kanang kung certified yung inyong HIE, no, yung sa ating, kasi dito, tatandaan mo din niyo dito yung clearinghouse, The clearinghouse will be the one who will collect and distribute the information. So, ibig sabihin, so, dili na si patient manually ang mag-share ng data niya. Automatic na si clearinghouse na siya. Okay. So, kapag certified po yung EHR ng isang hospital, no, they will get incentives po. And they should, they will get incentives as long as they meet the criteria and they are qualified. Yung nabanggit ko kanina na ONC, no, sila po yung mga nag-regulate nun. The ONC, Office of the National Coordinator. Sila po yung nag-regulate nun. Okay? So, I hope klaro sa inyo ha. So far, itong silang tatlo akibat sila, no? 'Di ba? EHR, pag magandang ang EHR natin, no, magandang EHR ng isang hospital, so it can be distributed by your Health Information Exchange. Ang PHR naman is yung own record nimo na manually ikaw in case na may mangyari sa iyo outside tas wala ka pang EHR sa isang hospital, they can use your PHR po, no, para ma-input, para magawaan kanila ng own electronic health record mo. Okay? So, I hope klaro po siya. So, let's talk about the next, no? The PACS. The Picture Archiving and Communication Systems. Okay? These securely stores and digitally transmit electronic images and clinically relevant reports. Kung kanina more on the data lang siya, this one is more on pictures archiving. So, ibig sabihin, ano ba yung mga sa laboratory na nag-require ng picture data? Yes po. Your X-ray results, your ultrasound results, these are the ones po na kasi nga lahi man gud ang system guys na kanang focus lang on picture lang, focus lang on data lang. Mas maganda man gud na ingato kanang separate sila. Why? Because if ma-overwhelm ang isa, let's say for example, isa lang talaga yung mag-gather ng data and pictures, lahat siya, baka ma-overwhelm. So that's why this is where the PACS come in, no? Picture Archiving and Communication System. Siya yung nag-store ng mga electronic images. Okay, from the test done to you in the hospital. Okay, so remember there are two widely used types of health information technology, the PACS and the VNA, which is discuss ko later. Okay, the VNA or the Vendor Neutral Archives. These two help manage and store the patient's medical images. So once again, ito sila, the EHR, PHR, no, Health Information Exchange, they are referring to kanang mga data. More on data sila. For the PACS, it is more on the images, no, medical images. Okay, so usually PACS and the VNA are integrate in radiology into the main hospital workflow. So radiology used to be the primary repository for medical images. So dati guys, no, actually this is really evident po, though I'm not a rad tech po, but I have friends na rad tech. So yung mga every time na nagpapa-x-ray tayo, okay, yung mga images po na na-capture po ng x-ray machine, actually ginastore yan nila. Yung mga hard drives din sila. Imagine niyo dati guys, may mga hard drives na. Tapos what if yung hard drive nila nag-corrupt? Okay? So this is where PACS come in. They can store it in the cloud, then the PACS, okay? The PACS will manage it, no? It will store and and keep it secure. Okay? So ngayon, hindi na mahirap wala nang takot kahit masira yung mga hard drive nila. They know that they have backups. Okay? So, hindi lang po sa X-ray ha. So, presently, other specialties such as cardiology and neurology are also among the large-scale producers of clinical images. Okay? VNAs can also be installed for the purpose of merging stored imaging data from various departments into a multi-facility healthcare system. So, we're going to talk about VNA na ngayon. Okay, kung itong PACS is ito siya, ang VNA naman is same po, no? It integrate radiology into the main hospital workflow, stores medical images, which is the same as the PACS, okay, in a standard format and interface, making them accessible to healthcare professionals regardless of what proprietary system created the images. So if you're going to make an understanding of the ginagawa ng VNA, no, from the PACS po, so si PACS nag-store siya ng data, tama? Si VNA po, i-store po din niya ang data, but however, no, siya ang mas nag-manage nito kasi nga gina-standardize niya ang format. So kung standardize ang format, there will be no discrepancy with the stored medical images. So mas easier po siya na ma-access ng different healthcare professionals. For example, bigyan ko kayo ng analogy ha. Nakatry kayo na mag-picture kayo from an iPhone, then an Android. The iPhone uses the HEI format, no? So there are some, minsan kapag yung picture galing sa iPhone, pag ilagay natin sa mga laptop, sometimes dili sila ma-view because the format is not supported. Okay? Dili siya standardized. However, here po si PACS na mag-collect ng data initially, then ipapasa niya kay VNA, no, kay VNA sa vendor neural archive natin. And then the vendor neural archive natin, siya po ang store ng medical images. However, this one in a standard format na. Okay, I hope nag-gets ninyo. Standard na yung format. So, ibig sabihin, easier na siya i-access and there is a lesser chance po na ma-corrupt yung data or dili siya ma-support or dili siya ma-view. Ingana siya. Okay, I hope na intindihan po ninyo, no? Because ano lang yan sila guys? Lima lang yan sila. EHR, ito sila. Okay, so let's have a review. Okay, sino gani ulit ang yung manually, ikaw lang personal ang magsulat ng medical data nimo? Yes, the PHR. Okay? Yung ikaw mismo manually ang maglagay ng mga allergies nimo. Usually, mga allergies man na siya, patient history nimo, ina na siya. Okay? Sino naman yung mag-ipon ng data, no? Yung data lang. Okay? Ipon ng data and mag-make sure na it is easily accessible or matransfer sa ibang hospital or agency. Very good. That is your HIE. Okay? Yung electronic health record naman, siya lang po yung data mo digital data mo sa hospital na yan. Kung nagpunta ka sa iba't ibang hospital po, si HIA mag-ipon lahat ng data mo. Okay? Para mas easier siya ma-share and ma-access ng different healthcare providers. Si PACS, once again, both sila, the PACS and VNA, they store medical images. However, si VNA po, more standard po yung kanyang format. So, ibig sabihin, kung mas standard yung format niya, mas easier po yung access. Most likely po kasi itong dalawa, the PACS and VNA, are joining sila together or they work hand in hand. Initially, i-store ni PACS, then ipasa kay VNA para ma-standardize yung format. Okay, very good. So, let's move on sa next topic natin. Okay, the health information ecosystem. Okay, health information ecosystem. Okay, this is, when you talk about ecosystem, ibig sabihin, iba't ibang system combined, no? So, napakaraming system po tayo. Okay, maraming system ang nandito. Okay, so a biological community of interacting organisms under physical environment, that which we're going to define ecosystem. Okay, but here in health information ecosystem, think of it as a digital environment. So ibig sabihin, dili siya same sa atong biology, no, na ecosystem, but here digital na siya. Okay, same gyapon, daghan gyapon mga factors daghan mga key players ang nandyan, but still they are in the realm of technology. Okay, so digital environment. Okay, so let's move on sa next slide natin. Okay, for the health interoperability ecosystem, no, it is again, when you talk about the HIMSS, or the Health Information and Management System Society, okay, so according sa kanila, no, the health interoperability ecosystem is a composition of individuals, systems, and processes that want to share, exchange, and access all forms of health information, including discrete, no, when you say discrete, guys, these are individually separate and distinct, no, narrative and multimedia. So parang ganito po yung titignan ninyo, parang ganito po yan. Okay, so parang this is an example of a digital health system. So according sa HIMSS, no, the health ecosystem po is para siyang ito silang lahat may access sila sa isang tao. Okay, the patient, 'di ba? The patient will use a device or an app, and then the app will store the data on the cloud. Okay, then sa cloud po, pwede po siyang ma-access ng mga kung sino po yung mga healthcare providers na yes, pupuntahan mo. Okay, so it might be a pharma stakeholder, the patient support services, then at the end si patient pa rin ang yes, magbe-benefit. Parang ganun po siya, no? Want to share, exchange, and access all forms of health information. Okay, so ibig sabihin, again, all our data po is usually, no, stored in the cloud nowadays. Okay, so remember po, an efficient health interoperability ecosystem provides an information infrastructure that uses technical standards, policies, and protocols to enable seamless and secure capture, discovery, exchange, and utilization of health information. So actually this is very good, no, na because easier na lang yung easier na tayo matulungan ng mga healthcare providers, no, but this is also kanang siya, subjected to kanang data thief, no, data theft. Pwede makawat imong data. However, kaya gani meron tayong yes, health information technology, health information systems to secure, no, sila ang nag-aayos ng data natin, interpret, secure our data. Okay, so since nasa cloud man tayo, no, nasa cloud malagay ang data natin, let's talk about the health informatics in the cloud. Okay, so remember po, cloud-based technology is an IT term referring to the data that can be accessed on demand by the user. Essentially, the cloud is in fact the internet. Yung same sa natin, yung mga hard drive, for example, 'di ba, sa drive, if I'm going to share a folder with you, no, a link, pwede niyo siyang ma-access. But I have, since I'm the one who made the folder, I have the control kung anong gusto ko. As viewer lang ba kayo, okay, ma-download ba, ma-open na yung link. However, if i-limit the access to only view only, dili niyo ma-delete ang mga content. Okay, so the role of cloud technology is undeniably significant in our everyday lives nowadays. Yes, definitely very, very significant. Okay, because we are modernized naman gota, guys. Okay, so currently 83% of healthcare organizations are making use of the cloud-based applications, and it is changing the landscape of healthcare systems and health informatics. Okay, so syempre maganda siya kasi nandun na sa cloud, but remember po, both benefit and threats exist. Okay, so maka-benefit tayo, at the same time there is the threat po na baka ma-hack ang data natin or something like that. Okay, so let's talk about cloud technology. No, these are the advantages of cloud technology. Integrated and efficient patient care, no, which offers a single access point for patient information. Okay? Allows multiple doctors to review the lab results. Maganda siya, okay? Doctors can spend more time diagnosing and treating patients instead of waiting for information. Okay? So, yun yung kinaganda niya guys, no? Tawag yan. The physicians can spend more time deciding and performing patient treatment instead of waiting for information from different departments. Kasi nga, nasa cloud naman siya. Instead na isa-isahin niya tawag ang department na, let's say, sa X-ray department, tayo mga medtech laboratories, no, saan naman tayo, ancillary department. Instead na isa-isahin niya, he can always access the cloud. If only the hospital na kung nasaan ka is using po, no, yung tinatawag natin na, yes, EHR, no, the electronic health record, okay? Pero kung yun ang ginagana ngayon, halos lahat ginagamit naman ito, okay? But sa una guys, lisod yun tsaka ayo, okay? Yun yung benefit natin ngayon, yun yung kinaganda niya, okay? The doctors can easily access your data, no, dili na niya ni tawagan pa ang OR na tugay kayo nga na matubag nga na, okay? So yun po yun, no. Another, there is a better management of data, no, more meaningful data mining, better assesses the health of the public. More data is equals to more opportunities to identify trends in diseases. Remember, the accumulation of electronic health records will allow more meaningful data mining that can better assess the health of the general public. So isa rin po ito siya sa gusto ko explain sa inyo, ha, that your AHR po, no, for example, ikaw, you are an HIV positive individual. Okay? Lahat ng HIV positive na individual po per hospital, gina-record po yan ang kung ilan na sila. Okay? And then per month, the data will be reported po. Okay? I am referring sa Pilipinas, ha. The data will be reported to the San Lazaro Hospital. Then the San Lazaro Hospital will make a tally kung gaano napakadami ang HIV positive individual. That's why hindi kayo magulat, malaman nila na ay nagiging dili na endemic kaning sakit sa kanilang lugar, ma-recognize na nila as pandemic. Okay? When the COVID first started po, 'di ba? Sa kadaming tao na maapektuhan, paano nila nalaman na ang Davao is 80%, 70% na may COVID, may nga nagunang putang. It's because of this one, no? Mabilis na ma-record ang data na nag-COVID positive isang patient. Therefore, yes, no, mas better siya na makabigay ng again, makita yung trend ng certain disease. Okay? So, yan po yun. Ito yung isa sa main reason nga nung mabalaan nila na naay outbreak. Okay? So, remember din, when talk about data mining, no, is the process of discovering the patterns in large data sets involving methods at the intersection of machine learning, statistics, and database system. The practice of examining large database in order to generate new information. So, dito papasok talaga heavily ang ating health informatics. 'Di ba? Kasi nga kung may data ka nga, pero who will try to assess, interpret your data? That is the health informatics. Okay? So with all advantages, no, syempre mayroon yan siyang kaakibat na disadvantages. Okay? There is a potential risk to your personal information, no? You are vulnerable to data breaches, information may be stolen. Ito sila, no, are very lalo na sa digital age talaga, ganun siya. Violations to privacy and confidentiality may arise, no? Okay? So, ang safeguards na pwede magawa natin dito is data encryption, proper data disposal, and proper backup. Okay? The strength of the cloud technology is also the very same characteristic that makes it vulnerable to data breaches. The information contained within medical records may be subjected to theft or other violation of privacy and confidentiality. So actually, ito yung always, kaya minsan matagal ang Pilipinas na ma-appeal sa best health system in the world because we are very prone to kanang daga magkawatan og dito sa Pinas. Oy, ambot na lang jud. Okay? So, but nevertheless, no, we are doing things naman kasi nga ito siya, no, we can have these different types of safeguards, no, na ginagawa. Safeguards may be put in place to minimize such threats, no. Okay? Encryption is the process of encoding a message or information in such a way that only the authorized party can access it, and those who are not authorized cannot. Okay, so that's why encrypt your data, everyone. Okay, so let's talk about cloud system setup. No? So cloud system setup seems cumbersome. Okay, transition to automated systems may be difficult to some members of the organization. So we really cannot involve everyone in this because meron tayong mga oldies guys na dili kaayo sila, no? Mas gusto nila yung traditional jud kaayo. Okay, so lisod siya, but nevertheless this technology will be adopted by more institution in the future. That will be the silver lining. That's why meron tayong ganito, no? With proper education and demo of its function may convince hesitant practitioners. So kayo na mga second year students natin, since you are introduced to this as early as now, dili na mo ka ng masyak-syak pag abot sa in time na kayo na yung mag-access sa mga data, no, ng mga patients ninyo, no? Pag maging doctors na kayo, hindi na kayo, easier na lang sa inyo kasi kabalo na mo. Okay, dili mo mga kanang maging boomer, no, na parang ay hindi lang, ano lang talaga, gusto ko sulat-sulat pa. Okay, so dili tama yung ana, ha. Dapat if the technology advances, you should advance alongside the technology. Okay, so let's talk about the health informatics in the Philippines po. Okay, the current climate of health informatics in the Philippines. Charles. Okay, so here po actually Pinoy manggod ta, no, whether we like it or not, we are Filipinos. So ang IT po dito sa Pilipinas is actually is one of the, and actually sa ibang bansa is one of the in demand po talaga ng mga jobs. Actually they earn more than medical technologies po, yung mga ITs. Okay, kasi nga technology advance maganda may ibang bansa. However dito sa Pilipinas, anong tawag natin sa mga IT? Pag dati pag nag-IT ang gineskwelahan sa estudyante, kasi giningon sa mga parents or mga people, mga tito nato, ingon ay tigbantay og computer shop, which is wrong. Okay, so dili dapat ang ato. That is because we lack the education po. But now, since you are heavily involved in technology na, okay, I hope you can get a newfound respect sa ating mga IT personnel. Okay, so let's talk about the different health informatics in the Philippines. So let's start with the next slide. Okay, so tawag yan here in the para mas maintindihan ninyo ang health informatics in the Philippines, no, let's talk about who started it all, no. Tawag yan, syempre ang pinakaunang computer po talaga na usually consumer based po na computer po na widely accepted, widely ginagamit ng mga tao is walang iba po ang nag-develop is the IBM. Okay, the International Business Machines na corporation. They are the ones who made kanang mga desktop computers na nakita ninyo, this one. Yan. Okay? So si Apple, meron din siyang ganito, pero expensive masyado ang sa Apple. Kaya gani consumer base, ibig sabihin, yes, sa mga kumpanya, mga lugar-lugar, ito talaga yung makita ninyo, IBM. Kasi commercially available siya, no? Pang consumer jud siya. Okay, so this is loosely practiced since 1980s, no. Meron tayong tinatawag na CHITS or the Community Health Information Tracking System. Okay, so itong CHITS po, no, tawag yan, siya yung nag-track ng mga health information, okay, noon. Those who have access to IBM computers use that to store information. Since then, significant milestones in health informatics have occurred over the years. One of these is yung ating CHITS. Okay, so actually guys, mag-start lamang good ang trend of storing data nga if the more people na nagagamit sa isang product. So we are really lucky that the IBM really boom, no? Marami nagagamit ng mga IBM computers. Kaya nagawa itong cheats natin. Okay? So this the cheats po are released under the general public license na GPL. Okay? So cheats was named finalist at the Stockholm Challenge 2006 and one of the top 3 e-government projects in the Philippines by the Asia Pacific Economic Cooperation or the APEC and the Digital Opportunity Center or the ADOC. Okay, so let's talk about cheats, no? Cheats. Charles. Okay, so cheats po or the Community Health Information Tracking System has a Linux, no, operating system. Okay? Has a Apache na server software. Okay? Has the MySQL na database. Okay? And then the PHP, tawag yan is, syempre PHP Pilipinas man. So this would be the scripting language. Okay? So, wait lang. Isulat ko na lang guys para mas maintindihan niyo. Okay. Okay. Si Linux. Yan. Linux ang kanyang OS. Si Apache ang kanyang web server. Web server software. Ayan. Si MySQL ang kanyang database. Itong PHP based system would be the scripting language kay Pilipinas man, no? Scripting language. Okay? Meaning it is the hypertext preprocessor. Okay? So this is an electronic medical record, no, EMR, developed through collaboration of information technology or the ICT community, primarily designed for the use of Philippine health centers in disadvantaged areas, currently utilized in 111 government health facilities. Okay? So, tawag yan, kung isa-isahin ko sila, itong MySQL is, meaning niya is my structured query language. Okay? My structured query language. Okay? So, this is the database. Okay? So, dati, okay, because of cheats, no, what is because of these cheats, what used to be manually done, yung manually na ginasulat, no, patient records for 4 to 5 minutes can now be executed for a couple within a couple of seconds. So mas easier na siya because of this one kasi na digitalize na siya. Okay, the implementation of cheats has indeed resulted in a higher efficiency rate among health workers since more time can be spent in providing patient care, no, instead na more on kanang magsulat ang imong i-focus, mas makapost ka ron ng healthcare workers na tabangan ka. Ingana siya. Okay? So, meron natin yung tinatawag na R cheats. Ito. Yan. R cheats. R stands for real time. Okay? Provide real-time monitoring of key maternal and child health. Okay? So, let's move sa next slide natin. So, issues that hampers progress of health informatics. These are the lack of interest. So, obviously, kung hindi ka talaga interesado, wa jud, no? I know you are bored with HIS, but wala jud mo choice. Okay? Kasi ito mga topics guys, more on IT na lang siya, and I know you are technologically advanced enough to understand, no, what I'm trying to say. Okay? So, I hope dili ito magka-lack of interest, no? But lack of interest is obviously one of the issues that hampers the progress of health informatics here in the Philippines. Seen more as a novelty rather than a profession, lacks of priority, benefits are not apparent to decision makers. So ito yung pinaka masakit. Okay? So nowadays kung tayo nga yung mga uncle ko gani, no, they taught mga IT kay tigbantay ra jud sa computer shop, how much more there are some senators, there are some people, there are some mga lawmakers natin that yung mga labi ng mga tiguang, no, they don't really know the importance of information technology. So yung iba, yes, mabagal. Kumbaga wala sila isalig. That's why mabagal ang progress natin. Titingnan ninyo dito, only 111. 'Di ba? So that is one of the problems po, no? Hindi nila makita yung benefits, no? The benefits are not apparent to decision makers. There is a large initial expenditure. So obviously, since technology po, mahal talagang technology. But trust me, once na ma-establish to, ma-standardize, we Filipinos will be the one who will reap the benefits. Okay? So, when professional and economic constraints comes into play, priorities shift towards clinical responsibilities at the expense of health informatics as a discipline. Okay? So, ano talaga siya guys, no? These are different issues that can hamper the progress. And I hope someday you as a students na mo, no, can help make a big difference in the future. Okay? So, that is for the part 1 of our, again, health information system. We're going to talk about sa part 2. Okay? Same gyapon, health information, gyapon siya. Health informatics gyapon siya. Okay? So, let's move sa next slide natin. So, for the health information systems, no, these are the different learning outcomes that I want everyone to understand at the end of this video lecture. Okay? So, storya na to. technology versus system. Kung kanina, we have the HIT, no? HIT, ayan. And then the HIM, the Health Information Management. Okay, now we're going to compare HIT, Health Information Technology, versus your HIS, Health Information System. Okay, so HIT focuses more on the tools that you are using, and this is a subset of your HIS. So obviously, HIS is the bigger picture here, no? Siya yung system ang good. Okay, it records, no? Responsible in the records, the coding, documentation, and administration of patient and ancillary services. That is the HIS. Ang HIM naman, siya yung naga-manage. Okay, I hope klaro ha. So, the HIT are the tools, no? Health Information Technology, the tools used, no, to standardize or to maneuver your HIS. Okay? So, tawag yan. The ancillary here, yan, ancillary here refers to the person or organization that provides necessary support. For example, in a hospital, the ancillary department there would be the laboratory, the radiology department, the ER. We are ancillary po. Okay? We are the ones who will support the patient, no, hanggang sa ma-diagnose siya ng doctor kung ano ang sakit sa kanya. Okay? So, information systems, no, umbrella term for systems, okay, people and processes designed to create, store, manipulate, distribute, and disseminate information. Okay? When you talk about the information technology, deals with the technology involved in systems themselves, no? The design, the implementation, the support, and management of computer-based. So, ibig sabihin, ang technology po is more on computer, kanang ano na dyan siya, kasi nga, pag sinabi mo kasing system, guys, pwede mo ganang system na pen and paper lang. Okay? Kaya more on documentation, nga na. So, ibig sabihin, as the technology advances, the system also advances. Nagets ninyo? So, dati, meron tayong health information system, but that is through the use of pen and paper. Okay? As the technology advances, yung na-develop na si health information technology, which focuses on the tools, subset siya ng HIS natin, as the technology advances, the HIS also advances. Okay? I hope na-gets ninyo guys, no? Ayaw, dili ta mawala, no? When you say system, it is anything po talaga. Okay? Pwede siya pen and paper, ganing lahat ng ginagamit natin na para maka-document, no, na maka-ano tayo ng information from the patient. That is the system. When you say technology po, yan po yung computer-based na mga information. Okay? So, let's move on sa next slide natin. So, sabi dito, Health Information Systems, okay? HIS, no? According kay Sheehan Charles. Defined HIS as a mechanism which keeps tracks of everything related to the patient, such as your patient's medical history, contact information, medication logs, okay? Magets niyo kasi ito sila, pwede man tumagawa pen and paper, logbook, okay? But since the technology advances, yes, the health information system advances alongside it. So that's why partner dyan ni sila. Okay? I hope dili mo mawala. Okay? So, ano pa? Appointment schedules, insurance information, and financial account, including billing and payment. So, the HIS keeps tracks of information from the patient. Everything from the medical history to the address, phone number, the medications that they take as maintenance or treatment, even the doctor's visit, medical insurance, and medical billings or costs are being tracked, okay, by the health information system. See, if magandang health information system mo, kasi gagandang health information system mo, kung maganda rin ang health information technology na meron kayo. Okay, health information technology refers to yung kanina, yung mga na-discuss natin kanina, the mga PINA, VNA, EHR, lahat yun sila. Okay, IEMR, lahat yun sila. Kung maganda yun, gaganda rin ang health information system. Okay, so I hope klaro po siya ha. Okay, so let's talk about sa next slide natin. Okay, so remember that health information system covers different systems that capture, store, manage, and transmit health-related information that can be sourced from individuals or activities of a health institution. So these are the different systems po na meron sa certain hospital. Okay, so for the laboratory, we use, ito yung ginagamit natin sa laboratory talaga, the LIS. Okay, Laboratory Information System. I can talk more about LIS Because ito yung ito yung gagamitin ninyo. So pag naging RMT kayo guys, you decided to work in a hospital, you will use two things po. The LIS as well as the HIS. Okay? The LIS and the HIS. For the LIS po, this is where you will going to input the data, no, na galing sa machine, galing sa mga testing ninyo, nandyan lahat. Okay? The data that you have input here in LIS will be transported to the HIS. Okay? Para ma-view na, let's say nag-upload ako ngayon ng data, let's say ang potassium na result niya is 4.1 yung gilagay ko doon na result for the potassium. Okay? Automatic yan. Real time, makikita yan ng doctor sa ER, no? Kung i-view niya yung HIS ng patient. Okay? So the doctors do not have access sa LIS because this is only for the for the laboratory lang. Okay? But the doctors have access sa HIS. Okay? Kasi nga, they are going to take a look at the patient's information. Okay? So, LIS is for the laboratory. Okay? So, meron tayong disease surveillance systems, district level routine information systems, no? The hospital patient administration systems, then the human resource management information system. These are the different systems po, no? Health information systems. Okay? So, the informations collected from well-functioning na HIS, well-functioning na HIS is very useful in policy making and decision making of health institutions and becomes the basis of creating program actions. Okay? So, yung mga data na makollect dito po, yun po yung magga-guide sa ating mga policy makers o decision makers po na sa isang institution na yan on what to do next. Okay? So, minsan, no, bigyan ko lang kayo ng example. Na-observe ng aming mga policy maker, decision maker sa hospital dati na there is increase, no, tumataas yung dengue cases. Paano ba nila malaman na tumaas ang dengue cases? It's because of the health information system. Nakita nila yung parang trend ng pagtaas ng number ng admissions, number ng cases na nandun. So what they did is that since yung dengue na cases namin is that based sa information na nakuha nila, they decided to lower the price of the CBC to help those patients in need. Okay? At that time po yun, binabaan nila yung result na presyo ng CBC. Kasi pansin nila, ka-dengue outbreak. Nga na siya. Okay? So, with this would translate to efficient resources allocation at a policy level and improvement of the quality and effectiveness of health at a delivery level. Okay? So, I hope na ninyo guys, no, ma-visualize ninyo yung kinaganda niya. Okay? So, let's talk about again the Pacific Health Information Network. So, according to them, sa ating PHIN, an excellent HIS should be sustainable. Wow! No, it should be able to continue over a certain period of time. Ibig sabihin, dapat parang relasyon ninyo pang matagalan. Sustainable ba? Okay? So, an HIS should be pang matagalan. Okay? Ano pa? It should be user-friendly. Okay? It should be user-friendly. It should be ease of use so that the people can understand and learn the system faster. Okay? This is according sa PHIN, ha? Okay? So, ano pa ba? It should be economical. So, economical, it should be, giving good value or service in relation to the amount of money, no? Ibig sabihin, kung magkano binayad nila, dapat same value dapat. Healthcare personnel should be educated on the use of routine data collected from the system, which is yung ginagawa natin ngayon. We are educating you as the students para puhon, dili ninyo ipagkalat ang mga data sa mga pasyente. Okay? And the significance of good quality data improving health. Okay? So, dapat economical jud siya. So, we also have the roles and function of your HIS. Okay? So, the roles that a well-implemented HIS can perform improving the healthcare as follows. No? It should be easier to access. Okay? Easier to access files. No? Need for hard copy becomes optional because systems are electronic. Tama. So remember, these systems have revolutionized the collection and management of patients. So, gone are the days of kanang manually ninyo kada si patient, kada isang tao kay siya own chart, no? Wala na yung ngayon, no? Kasi nga, yes, we are all digitalized na. Okay, we are in the digital age na. Okay, better control. Only authorized personnel can have access information on the patient's health. Doctors may be given permission to update patient information, while a receptionist may only have the authority to update a patient's appointment. So same thing with the with the with the LIS, no? With the LIS, with the laboratory information system, no, though after na ma-upload ang result, tapos makita ni doc sa HIS, okay, only the authorized people, for example, na mali, which is sana hindi mangyari sa inyo someday, no, na mali og type, instead ng 4.1 ang result ni patient, na type na medtech, kay, let's say, lotaw dyan siya kaayo, 41.0. That is wrong. So ngayon, let's say for example, nakita ni doc, na-shock siya, so tinawagan niya balik ang lab, pa-double check doc ko kung ano. Tapos maingon si medtech na, ay doc, 4.1 dapat yan. Kahit alam ni doc na 4.1 ang result, the doctor does not have the copy. Doesn't have the authority, the permission to change the result. Only the laboratory personnel has the capability to change the result. Okay? Same thing din, if the doctor wanted to change the medication of the of the patient, only the doctor has the authority or the permission to update yung kanyang mga medication. However, since kasi ganito yan, ang HIS mga good guys is lahat ng sa hospital actually may access yun sila. But the level of access na meron ang bawat hospital, lahi-lahi. Nagets niyo? So yung mga admin namin, wala yan sila masyadong access sa mga patients data kanang laboratory result ng mga wala yun silang access kasi admin man sila, hindi man sila healthcare professional. Nagets niyo? Sino may mga access sa mga patient data, mga patient information? Yes, tayo po, mga healthcare providers. Okay? Same thing, the laboratory has no access sa x-ray record ng patient. Dili na ito makita ang kanyang mga VNA, ng pictures, digital images, no. The RadTech has the access, but the RadTech does not have the access sa patient information in the laboratory na part. Okay? So, this one gives one of the roles and function of the HIS is to have a bit better control. Okay? So, another thing is the easier update. Patient information access and reviewed anytime. Copies can be printed and released by the patient request. So, after the creation of the record, the patient information can be, pwede ma-access ni patient upon request. Okay? Next one, we have the improved communication. Okay, the HIS assists communication among the doctors and hospitals. However, medical professionals must adhere to regulation on the patient privacy and security to ensure that information is kept confidential and safe from unauthorized access. Kaya nga sinabi ko sa inyo no, per department, lahi-lahi ang level. Lahat kayo may access sa HIS, but the level of access differs from one department to another. Okay? So, yung HR sa hospital, wala yun sila access sa patient's medical record po. Okay? Wala yan sila access. What they do have access is yung mga more on the mga payments, mga bills, mga finance department, more on the payments, mga bills. Okay? Yan siya, lahi magudog access. Okay? Pero lahat sila may access. Okay? So, tawag yan, I hope na gets ninyo, no? Kasi nga guys, if there is merong mga people po na sometimes mischievous or gusto dyan magpakalat o gano'n, pwede dyan nila ikalat na, for example, mayroon sila na, dito sa hospital na dapat ang may access lang sa HIV result would be the HIV proficient na mga medtechs or individuals. Tapos, let's say, merong naka-alam ng password mo or meron unauthorized na access niya. So, mangyari dyan is, pwede niya ikalat ngayon. Okay? I hope na naintindihan. So, someday, I hope everyone will be able na dili good ang buhaton. Okay? So, that's why gina-educate mo. Okay? So, remember that a good health information system delivers timely and accurate information, upholds transparency and accountability. So, this would enable decision makers to make an informed choices about the different aspect of health institution, from patient care to annual budget. So, this is an example. Yung kanina, sinabi ko regarding sa dengue, napansin nila na ganun ang nangyari based on the data. So, they decided to lower down the price of the CBC. Okay? So, daghan na siya guys. Daghan ang pwede mabuhat ng ato ang mga decision makers po. Okay? So, next one, we're going to talk about the components of your HIS. Okay? So, the Health Metrics Network was a global health partnership focused on strengthening health information systems in low and middle income countries. So, here, So again, framework and standards for country health information system noong 2008 was, so again, ginawa ng ating health metrics network. Okay, so again, pag-usapan natin unsa din composition sa inyo ang HIS. So imagine having a pie, no, kanang ito, yung pie. Ayan. So since system man siya, no, it is composed of different parts po, different pieces of the pie. Okay? So isa-isahin natin siya. So si HMN, no, once again, HMN, the Health Metrics Networks, siya yung nag-ano nito, no, naggawa ng framework nito. Sabi nila, should include, okay, include the framework on legislation, regulation, planning, and the resources required for system to be fully functional. These are the physical resources, human resources, financing scheme. So, ito yung one piece ng pie natin, the health information system resources. Ito po yung mga different resources. Example nito would be the personnels. Saan tayo banda dun kung personnel? Sa human resources tayo. Okay? The financing, no? The financing scheme. Physical resources, this would be the logistics, the supports, the components, no? Different na mga materials. Okay? So, lahat yan sila guys are important for the system to be fully functional. Okay? For the system to be fully functional. Okay? So, let's talk about the indicators, no? So, these are the different determinants of health, system inputs, outputs, and outcomes, and the health status. So, these are the determinants of health: water quality, hygiene practices, morbidity, and the mortality indicators, social, economic, physiological environment, person's individual condition, and behavior. The basis of the HIS plan and strategy includes indicators and related targets such as determinants of health system. Ito sila, no? Mga inputs, outputs, and outcomes. So, itong mga health indicators nito, they are quantifiable po. Quantifiable characteristic of a population. No, based on this data, okay, based on this data, maraming magagawa. Okay, based on the data gathers, no, based on these indicators, maraming data po ang mag-gather. Marami pong mga decision ang pwedeng ma-make because of these indicators. Okay? So, another piece of the pie would be the data sources. Okay? So, data sources would be a population-based, no? Or an institution-based data. So, when you say population-based, no? It approaches like a civil registration, census, yan, population surveys, yan po yung population-based na data. Pag institution-based data naman, it is more on the individual records, resource records, and service records. So, occasional health surveys, research, and information produced by the community-based organization may not be directly classified under main categories, but they are, may provide useful information. Okay, so once again, yung mga occasional lang na health surveys, research, and information, dili jud sila kanang classified under the main categories po ha, but however, they can provide useful information too. Okay, yun lang. Basta pag sinabi yung population base, ito sila yung mga civil registration, no, census, mga population survey. Pag sinabi niyo naman institutional based data, these are your individual records, resources records, no, and service records. Okay, yung occasional health surveys, research informations, dili po. Okay, dili siya include. Okay, so we also have the data management. So obviously, after gathering the data sources, now is the time to manage them. Okay, but it should be managed wisely. Okay, analyze the data and make sense of what does the data entails. Okay, and what is its significance, relevance, and how do you store and collect the data. So that is the purpose of your data management, which is one of the components of your HIS. So here, it refers to the handling of data starting from collection and storage, data flow, quality assurance, processing and compilation, and data analysis. Okay? So, another piece of the pie would be the information plan. Nakita nyo guys, paikot tayo. No? Paikot. Okay? So, once na the data is transformed into useful information, na-analyze na siya, okay? It will serve as an evidence and provides insight that is crucial to shaping health actions. This is where policies and programs, medical interventions and drugs is magawa. Nag-gets niyo? Based on the information, they started small, no? Parang simple information na from there, i-analyze siya. Hanggang ngayon, meron na tayong information products. Okay? It means transforming the data into actionable goals. Okay? So here po, no, that's why if sa Davao City, if we're going to make an analogy, here in Davao City, meron na tayong no smoking ordinance. It's because the data shows that in the different hospital, no, different hospitals, there are lots of patients po dying because of lung-related na mga sakit. That's why the mayor issued a no smoking ordinance. So bawal jud manigarilyo bisag asa diri sa Davao. Dakpon jud ka. Okay? Dakpon ka. So, with this in mind, kasi napansin nila, no, based on the data, na tumataas na yung mga nagkakaroon ng lung problem because of smoking. Okay? Lung problem because of smoking. Because of the data gathered, no, they made an actionable, yes, goal. And that goal is to lower, okay, lower yung risk ng mga patient na maapektuhan ng sakit due to smoking. And yung actionable goal na yun is the no smoking ordinance. Okay? So, I hope na intindihan ninyo, no, ang topics natin so far. So we are in the last pi, dissemination and use. Here po, no, when we say dissemination, it is the spread, the informing the people or educate the people, no. With this in mind, it enhances the value of health information by making it readily available to policymakers and data users, and most likely implementing to the public. Okay, so once na, let's say for example, yung kanina, no, the no smoking ordinance, once na napirmahan yun siya because that is your actionable goal, yeah, that's a kahit saan ka na sa Davao, may makita ka, no smoking, ingana. Okay, yan yung dissemination and use. Okay, they use the data, they make a information product regarding that, and then they disseminate it to the public. Okay, so I hope klaro po siya ha. I hope na klaro po siya. So, remember, there are 6 components of health information system that can be categorized, no, into inputs, processes, and outputs. Okay? So, isa natin sila. Ang inputs natin would be this one, health information system resources, kung saan kasama tayo, no, mga tao. The processes would be this one. Okay? Core indicators are needed as basis for program planning, monitoring, and evaluation. Importantly, this data must be accessible, syempre, and understandable by users and policymakers, no? Yan sila. And then the outputs would be, yes, ito na siya, outputs, no? Yung ating information products and yung ating actionable goals, no? The actionable goals, no? It refers to the transformation of data into information that can be used for decision making and dissemination of the use of such information. Okay? So, kung i-simplify natin siya, you have the inputs here, HIS resources, i-process ang data. After that, output. I hope klaro po siya. Okay? Input, process, output. Okay, so let's move on sa next slide and talk about the different data sources for health information system. Okay, so today, now we're going to talk about the different data sources for health information system. This is according to Donaldson and Lore. Okay, state that the need for a comprehensive database. So, according to them, no, a health information system include the following. So, isa-isa na po siya. Una, the demographic data, no, which refers to the facts about the patient, which includes all of this. Okay, so these are relating to the structure of the population. These are information on the educational background and employment is also recorded here, along with the information on the immediate family members to be contacted during emergency. That is your part ng demographic data natin. Okay? Another, we also have the administrative data, okay, which includes information on services such as this one, mga administrative data yun sila. Okay? So, once again po, we are talking about the comprehensive database po ha, that a HIS should have. No? These are the database that a HIS should have. Okay? Next, we're going to talk about the health risk information, which records the lifestyle and behavior of a patient and facts about his or her family's medical history and other genetic factors. So, when we talk about lifestyle and behavior, this is referring to kanang nagayosi ba siya, nag-engage ba siya sa mga strenuous activities such as kanang nag-marathon ba, ingana. Yan yung mga lifestyle and behavior po. This information is used to evaluate the patient's propensity for different diseases. So, ibig sabihin, most likely, kung nagayosi siya, no, dako ang chance jud na magkaroon siya ng mga lung diseases. So, yan po yung isa sa mga health risk information. Okay? And as well as yung sa, dito po, family's medical history. There are some diseases kasi na genetically, pwede mo mak-acquire. For example, if your parents are diabetic, kanang high blood, no, most likely, you as a person will also acquire it someday, or hindi man ikaw, yung anak mo, nga na, that is the family's medical history. Okay, gina-record po na siya. Okay? So, we also have the health status, which refers to the quality of life that the patient leads, which is crucial to his or her health. So, okay, this shows the domains of health, which include physical functioning, mental and emotional well-being, cognitive functioning, and social functioning. So, ibig sabihin, when you talk about health status, it's not only kanang, are you feeling well? No, it's not that. Okay? The quality of life ang ginaano natin. So, ibig sabihin, daghan, no? Meron tayong physical, mental, emotional, cognitive, and social. Okay? It also shows one person's perception of his or her health in comparison with his or her peers. Okay? Another thing would be include physical functioning, mentally ito siya, cognitive functioning. So, yan po yung mga another. When you talk about cognitive po, no, these are included here in health status lata. When you talk about cognitive, it refers to the awareness and understanding. Okay? Awareness nimo sa around your surroundings, ano siya. Okay? So, another one would be the perception, yung kanang ano yung na-feel mo toward yung constantly nimo gina-compare ang sarili mo sa other people. For example, may mo kanang ay siya payat siya, ingana ako dili. So ikaw karon dili ka mukaon. Moabot sa point na yes, magkaroon ka ng tinatawag natin na anorexia. Yan. Anorexia means kanang dili gud mo mukaon kana siya. Anorexia na siya. Kanang wala na ikaon-kaon, ingana anorexia na siya. So that's why if makadungog mo nang ingnan mo na ng sobra ng diet, ay anorexic ang patient na so ibig sabihin wala jud na siya gana. Okay, so more on food restriction. Ang counterpart ng anorexia is yung pica. Pica is bisag unsa ka unon kana ang pica. Yung mga eating disorder na sila guys, okay, because of your perception, no, in comparison sa others. Okay, so health status po na siya. Okay, patient's medical history, information of past medical encounters, previous illnesses, and family history, hospital admission, pregnancies and live birth, surgical procedures done to you, alcoholism, parental divorce. These are all gina-record po sa patient medical history. Are you palahubog ba ka? Dagan na sila guys, no? Ang ginaano. Okay? And then, the current medical management, ito sila. Okay? So, these are yung kanang mga ginahimo sa imuha while you are in the hospital. Okay? So, these are the datas gathered while you are admitted in the hospital. Okay? So, another thing would be the outcomes data, no? Presence measures of after effect of the healthcare and various health problems. Yung after mo ba magpagamot, kanang outcome ng good. So, ibig sabihin, after mo magpagamot, kanang do you feel better or do you feel worse? So, these data usually show healthcare events. Yan, ito siya. Healthcare events, no? Hospitals, healthcare events, no? Readmission to hospital, unexpected complications or side effects, and measures of satisfaction with care, no? So remember here also that outcomes directly reported by the patient after treatment will be most useful. So obviously, if nag-try po ang isang doctor ng bagong gamot, usually gina-ask yun ang patient, how do you feel? How do you feel? Nana. Okay? So I hope naintindihan niyo guys the different databases po, no? Database na involved in your HIS, no? The comprehensive database. So we have demographic, administrative, health risk, health status, patient medical history, current medical management, and then the outcomes data. So what have you learned so far? So if no, you can take a screenshot of this one and try to answer this on your own. If you can answer this on your own, no, after rewatching again the vidlec and again after studying, it means you are ready to ace the exam. So I wish everyone good luck for the upcoming prelim examination. Okay, so for further reading, if you want to read more, no, you can check and visit this website, no, para at least marami mong mabalaan. Okay, so once again, my name is Sir Neil. Thank you so much for listening in our HIS lecture. I really appreciate everyone's time. Okay, thank you so much. God bless everyone. Bye bye.